let's get some more of that good old American drug history. The greatest drug fiends in the world, an American opioid crisis in 1908. See, in 1908, ladies and gentlemen, Black people were sharecropping. Black women were working domestically inside the homes of white folks, and they were being picked up on bogus charges like vagrancy and not having a job and laughing out loud in public. You know, those real violent crimes that we're told we're doing all the time. While we were in hard labor, our white counterparts were getting high. They were working hard at getting high. But let's get into this great American white bread history. In this illustration of McClure magazine story, a woman left displays her needle marks. Oh man, oh man. Genteel women with easy access to doctors and drugs made up the majority of late 19th century addicts. She's gazing down at those track marks on her arms, ladies and gentlemen, working hard at getting high. The president, a swaggering populist from New York, was worried that a national crisis of opiates addiction was weakening America and diminishing its greatness that it never had. So, in 1908, Teddy Roosevelt appointed a handsome doctor with a handlebar mustache. Yeah, right. He probably looked like a monkey with a mustache. Hamilton Wright to be the nation's first opium commissioner. See, they had to do the same thing back then as they do now because so many of these caucasoids were just straight up junkies. While we were working hard, they were working hard at getting high. Americans, right warned, have become the greatest drug fiends in the world. Now, what's going on now? The biggest junkies on the planet are in America. America leads the entire world in drug addiction. See, ladies and gentlemen, these people just simply can't change. They just can't change. But let's get a little more into this great white bread history. The United States developed a pernicious narcotic habit in the decades after the Civil War. Anguished veterans were hooked on morphine. Now, aren't the VA veterans of today hooked on opioids? Some things never change. Gentile society women dosed up on laudanum and tincture of alcohol and opium. So they were mixing alcohol and opium just like they are today. The wonder drug was widely used as a cough suppressant and proved very effective in treating diarrhea in kids. So see, look, they were doping up their kids with opioids, talking about it's good for diarrhea. Opiates were wickedly addictive too. And as more and more Americans began abusing them, their control became a cause célèbre for progressive era reformers like Wright. The habit has this nation in its grip to an astonishing extent, he told the New York Times in 1911. Our prisons and hospitals are full of victims of it. It has robbed 10,000 businessmen of moral sense and made them beasts who prey upon their fellows. It has become one of the most futile causes of unhappiness and sin in America, United States. More than a century later, America has relapsed. The current opioid abuse plague is more lethal, with record number of fatal overdoses, public health experts note. But it's not the first time in U.S. history that the lax commercialization of legal opioids led to a national plague. But see, this time the plague is worldwide. It's just that America has the biggest junkies in the world because they got the biggest people that are the most full of shit in the world, too. So it all makes sense. The little known history of America's first experiment with narcotic and the federal government response to it are today a source of optimism for those who argue that tougher regulation and enforcement can bring the current crisis under control. Well, it's been 20 years of waiting for you to bring it under control. I guess, well, whatever. That is your problem. Faced with a late 19th century dope scourge, doctors, pharmacists, and federal law enforcement officials eventually managed to contain the country's first addiction plague. And look, here's their soothing opioid cough syrup for infants, drugging up the infants, working hard at getting high. Miss Winslow will relieve gripping in the bowels. Sounds disgusting. Instantly cure when colic. Soothing syrup for children. Yeah, just drugging up the children so they can shut the hell up. That's what it was for. And its active ingredients was morphine. Yeah, I guess it was popular. Too lazy to deal with your kids, so you drugged them up so they could leave you alone. Over the last 150 years of drug use in America, when a problem has emerged, the government has responded, said the DEA official Sean Ferrens, the former director of the agency's small museum on the ground floor of its headquarters near the Pentagon. I wish we wouldn't have to keep learning about the dangers of these drugs the hard way, he said. But ultimately, the turning point comes only when people really begin to see the damage we are doing to our society. Well, you must not be seeing that at all because y'all been drug addicts since you've been on American soil. But let's move on. Lesser waves of opiates abuse, especially heroin, returned several times during the 20th century, especially in large cities, and most notably in the 1970s, ladies and gentlemen. Drug use all through the centuries. America famous for being the biggest druggies the world over. But let's move on. But the late 19th century was the only other era in US history where the opiates addiction was truly a nationwide crisis, scholars say, afflicting urban and rural areas alike, up and down the country's social and economic strata. Then, as now, it started with drug manufacturers, doctors, and pharmacists, not pushers on the street. The advent of the hypodermic needle. The sticky sap of the opium poppy has been relieving pain and getting people high for at least 5,000 years. Ancient Sumerians called it the joy plant. The Egyptians traded opium throughout the Mediterranean, and itinerant Arab merchants probably introduced it to China in the 7th century. Just druggies worldwide. Opium became an engine of human commerce and conquest. English merchants, led by English East Indian Company, arguably the world's first modern drug cartel. The English, the first drug cartels. Okay, set up extensive colonial era opium supply chains that dominate sales in Europe and East Asia. When the Chinese emperors tried to stop them, the British waged the Opium Wars of the mid-19th century, occupying Hong Kong to make sure the drug markets remained open. Now, do you wonder why China is shipping over so much fentanyl and opioids to the US? Maybe it's revenge for those opium wars. But don't expect the Caucasoids to wake up. They just simply won't piece it together. So let's move on, ladies and gentlemen. English poets romanticized the recreational use of drugs. You know what? This makes me laugh because I read an article on heroin addicts saying they love the feeling of the high because it makes them feel like they're in love. And they romanticized about drugs. And by the time Thomas de Quincey published Confessions of an English Opioid Eater, Confessions of an English Opium Eater. Oh, yeah, that sounds really romantic. In 1821, the British were importing tens of thousands of pounds of it per year. Historians said it wasn't until after the American Civil War that the use and abuse of opiates spread widely across the United States. Some of the first addicts were morphine-dependent veterans of the war, suffering from all manner of physical and psychological pain, an infliction known as soldier's disease. Boy, they come up with these elaborate names. I just don't know what I'm going to do. So in other words, your soldiers were a bunch of junkies. You know, you really think about it, the most animated these people ever were was when they were lynching black people in the Civil War. Other than that, the history is already written. They didn't work. White people did not work during slavery. Okay, look at them old, probably drugged up morphine looking soldiers here. Let's move on. Go take a bath. Okay. Morphine was invented in the 1820s. But, sorry, ladies and gentlemen, I got to get the phone. I'll be right back. I love my family, but they have some rotten ass timing. All right, ladies and gentlemen, let's move on. Now, where was I? Morphine was invented in the 1820s, but it was the advent of the hypodermic needle that allowed the drug to be injected for the first time. The quick delivery to the bloodstream dramatically intensified the euphoric payload. Soon, syringes were being sold through the Sears and Roebuck catalog. They also sold cocaine, ladies and gentlemen, in the catalog. Let's move on with DIY, do-it-yourself drug vials, according to the DEA's Ferns. Around the same time, you began to see an admonitory literature appear in medical journals saying, you need to be careful with this. Don't leave the syringe with the patient, according to David Courtwright, a leading historian on American drug abuse at the University of North Florida. For decades, opium, morphine, and other narcotics had been the active ingredients in an array of unregulated tinctures and cure-alls sold by neighborhood apothecaries. Itinerant peddlers or doctors making house calls. Oh, so the doctor came right to your house with the opium, huh? How convenient, ladies and gentlemen, working hard and getting high. Just as the contemporary opiate crisis appears to have a gender imbalance, with increasing proportion of women getting hooked. The 19th century addict was typically female and middle class, according to Courtwright, author, Dark Paradise. The history of opiate addiction in America. Women were prescribed opiates after childbirth. Oh my goodness. And to treat female problems, menstrual cramps. Yeah, while the Black woman got nothing. Moving on. Many migrant workers from China who were hired to build roads and railroads and became addicts in labor camps and tenements of Western cities. Remember, they had the drug dens. In fact, that's what they're sitting in right now. The first drug control ordinance in U.S. history were issued in San Francisco in an attempt to stop the spread of opium dens, where the white clientele gladly visited with their $8. Unbelievable. Looked like a roach hotel, but moving on. Then, 1895, German pharmaceutical giant Bayer came out with a new wonder drug, more powerful than aspirin, that worked phenomenally well as a cough suppressant. Its name was Hiroshik. It was hero shit. Meaning strong, heroic, But in the United States, it was marketed under a different brand named heroin. I like hero shit better. I'm calling heroin hero shit. Hero shit. Along with cocaine, it was recommended as safe alternative to morphine for addicts trying to shake their dependency and flooded the markets in many forms, tinctures, pills, even heroin, throat lozenges. These people are such junkies, man. So they had liquid form, pill form, and a throat lozenger. They're all loaded with morphine, with heroin. It possessed many advantages over morphine. The Boston Medical and Surgical Journal wrote in 1900 advancing claims with a chilling similarity to early advertisements for OxyContin. It's not hypnotic, and there's no danger of acquiring a habit. You don't have nothing on the streets now but a bunch of habit forming drugs. And this is why those addicts have grown over 20 years to 23 million in America. No danger of acquiring a habit. Yeah, yeah, right. The first drug kingpins. Around that time, the specter of the junkie and dope fiend began to appear as a stigmatized character in lurid newspaper accounts. The early 20th century was also a period of racial anxiety and growing hostility towards migrants. And didn't Trump just put another travel ban in effect? Still showing all that anxiety and hostility towards immigrants. Ladies and gentlemen, some things never change. Some things never change. Change is not what they can handle. That's why they're going to be crying on their way out. In their push for narcotics, crackdowns, crusaders like Wright and the Opium Commission played to fears that opium smoking white women would end up trading drugs for sex with Asian men. No, see, that's where your woman is a willing participant. They just don't want to believe their women will sleep with any man on this planet and don't give a damn. Don't want to believe it. The temperance movement wasn't just alcohol, it was also drugs that were ruining the moral temperament of Americans, said Lloyd Setterer, the chief medical officer of the New York Office of Mental Health and the author of a forthcoming book about the current opioid crisis. Mm-mm-mm. Again, Black people were sharecropping and on prison farms over vagrancy and laughing out loud in public. Our women were domestic workers and they were getting high. The US government began taxing opium in 1890, and the passage of the Pure Food and Drug Act of 1906 forced manufacturers to disclose the content of their products so consumers wary of the drug would know if it was lurking in their kids' cough syrup or not. You see them passing all kinds of legislation and, about the drug plague that's going on. And you can see they were doing the same thing back then. These people are like a broken record in history. 3 years later, Congress passed the Opium Exclusion Act, banning its import for the purpose of smoking. Okay, so it was okay to do as long as you weren't smoking it. These people are silly. No wonder why you got a drug problem in 2017. Roosevelt sent Wright to lead an American delegation for the first International Opium Commission in Shanghai in 1909 and another gathering at The Hague in 1912 that produced the first global attempt to regulate narcotics. And I guess these were your people that were there at the conference. No wonder why you still got a drug problem. Wright continued to push for U.S. legislation over the objections of drug manufacturers, an effort that culminating the Harris Narcotic Act, Tax Act of 1914. It taxed and tightly regulated the sale and distribution of opium and cocaine-based products, the first broad crackdown in a century of American narcotics prohibition. Opiates remained available for short-term medical use. Isn't that what they're now saying? The doctors are trying to prescribe opioids only for 5 days now. Ain't working. But not to maintain addiction, and thousands of doctors and pharmacists were arrested under the Harrison laws, according to Cetera. A younger generation of physicians viewed opiates far more warily, issuing fewer prescriptions, said Courtwright, and made crucial differences in the prevention of new addicts. Isn't that what they're doing now? See, these people, they can't change for shit. You can see why their society is failing when it comes down to the drugs. They struggled with drugs in the past, they're struggling with drugs now. Oh, let's move on. Prohibition era gangsters like Arnold Rothstein, who trafficked it in illegal heroin, would become the country's first drug kingpins in the 1920s, but the number of opiate addicts, Americans, would never be as large again until now. At the peak of the 19th century addiction crisis, roughly 300,000 Americans were probably hooked, according to Courtwright, despite higher estimates by Wright and other activists that were probably inflated. See, they couldn't get an accurate number then, and they can't get one now. Some things never change, ladies and gentlemen. You can count on these people never, ever changing. Today, the United States have 4 times as many people, but perhaps 10 times as many addicts. Stop overdoses. Carry naloxone. You seriously put this billboard up? Oh my God. It's a billboard in Ohio. Moreover, 21st century dope, especially heroin, spiked with synthetic opioids like fentanyl, is more addictive than anything before, according to narcotics experts. The highs are higher. Isn't that what they like? As are the risk of lethal overdose. U.S. law enforcement agents have never had to confront criminal networks as sophisticated and well-financed as the drug traffickers who dominate narcotic distribution today. And the flow of American opioid continue over and under the counter. while new prescriptions for opioid-based drugs peaked in 2011 and have declined slightly. Prescribing levels in 2015 were still 3 times that of 1999. The latest figures show dependent Americans who can no longer get the drugs from pharmacies are turning to illegal markets in greater numbers than ever before, or they're just holding up the pharmacy altogether or anywhere that got drugs. That is the biggest difference between the 19th century crisis and the contemporary one, said Dr. DuPont, the former White House drug czar, who helped develop the first methadone maintenance program in the 1970s to treat heroin addiction. So treat drugs with drugs. Ladies and gentlemen, this drug plague ain't going nowhere. These high IQ people never fail to amaze me. Let's move on. Both plagues began with over-the-counter prescription of pain medication, but today illegal traffickers are far more able to step in as the government cracks down. The sea change is the illegal market, DuPont said. The move towards synthetic opioids like fentanyl will make everything much harder. The dogs can't sniff it. You can send it through the mail. It's very scary. Mm-mm-mm. Mm-mm-mm. Ladies and gentlemen, you know what this proves? It proves that America has never conquered a drug problem since she's been colonized. Okay? They had an inability to stop drugs then, and they have an inability to stop drugs now, but these are the ones with the high IQs. They are the ones that know everything. They are the ones that got everything. Even when you give them all kinds of advantages, they still can't overcome a drug addiction. Those same opioids are prescribed to Black people, but since doctors believe we don't feel pain, we didn't get hooked on it like white people did. So, ladies and gentlemen, drug fiends of yesterday are the drug fiends of today. Please tell me what you think about this great white bread American history, y'all. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.